Hello, everyone. Welcome to this webinar for the Master of Public Health Online. Just giving you guys a few more minutes to join. I know we started a little bit late, had some technical issues, but looking forward to seeing you all here. We've got 8, 11, 10 attendees. Great, thank you. Thanks for everyone who's just joining now. Welcome. Okay. I think that's around the rough numbers we expected, so I'll crack on. Good afternoon, everyone. My name's Dr. Thomas Hone, and I'm the co-director of the MPH Online at Imperial College London. Thank you for joining us here today with our admissions webinar. I'd just like to introduce the rest of the team. So next slide, please, Anna. So, as I said, my name's Thomas, and Natasha, would you like to introduce yourself?
Sure, thanks, Tom. Hi, everyone. I'm Dr. Natasha Kroom. I'm the Deputy Director of this course. I'm also one of the module leads of the research portfolio, which I will touch upon a bit later, but those are the modules where you undertake your own research project. Lovely to meet you all.
Thanks, Natasha. And Anna?
I am the program coordinator, so I oversee the program administration and student support and all the bits and pieces that make the program run.
Definitely. Thank you, Anna. And Scott?
Hi everyone, my name is Scott Paling. I'm one of the program administrators, and today I will be fielding the Q&A. So if you've got any questions that come up during the webinar, pop them in the Q&A, and I'll either try to answer them myself or direct them to the appropriate colleague as we go to the question part of our webinar.
Thank you. And Patson?
Hi everyone, this is Patson here. I'm also an administrator on the program, and I'll be answering any admissions queries that you may have during this webinar. Nice to meet you all.
Great, thank you. And we're also joined by two wonderful alumni. We have Paul and Emmanuel, and I'll probably get round to you in a little bit and give you a bit more of a formal introduction in the alumni session. So thank you for joining us as well as panelists. Just a quick overview of our agenda today. I'm just going to talk a little bit about the course now, the overview of the course and our mission and goals for the MPH Online. I'm going to hand you over to Natasha, who's going to run you through a little bit more details about the modules, the research portfolio. We'll then hear from our alumni about their experiences of the course. We'll have a dedicated session on the admissions process and entry requirements, and Natasha, Anna, and Patson will be covering that. And last of all, it'll be back to me to go through any Q&As and queries that we have. So please do put your questions in the box as you go, and we'll try and answer them. No question is it's too stupid. We need to make sure everybody understands and you're fully clear about our admissions process. So thank you. Next slide, please, Anna. So why should you be choosing the Master of Public Health Online at Imperial College? We think this is a super exciting and a really important course in the field of public health globally. One of our real strengths is it's part-time. So you can study the MPH online while you're carrying out your normal jobs and your careers. We have flexible pathways that allow you to do this over 2 or 3 years. So we think the flexibility of this course is really, really important. And we've tailored all of the education materials to meet those that are working full time. We don't have any in-person teaching requirements, and we think that's a real strength here. We have a flexible learning pathway as well. So there's lots of different modules for you to choose from. Some of them are core, but there's lots of options and optional modules for you to pick, and these can reflect your interests and your career aspirations. We also have academic advice that we can help you choose those pathways which best align with your future aspirations. We really pride ourselves on the materials that we've developed for this course. It's not just about reading textbook chapters at home and then coming forward a couple of weeks later. We have over, I think it's 800 videos that we've developed for this course, all specifically tailored for learning MPH core skills. There's also lots of online activities, quizzes, and loads of engaging live sessions with the course teams and external speakers. Next slide, please. Another really important thing is that this course is taught by global leaders in public health. This includes people that are, this includes the teaching team, and they currently work in loads of global public health issues, working with big NGO organizations like WHO and World Bank, but also working with like domestic priorities in the NHS and UK government. Every year we update our curriculum to keep on trend with the current emerging global issues in public health, and we update lots of our latest research into the public health curriculum. We pride ourselves on our really high quality academic support. We have the Centre for Academic English, there's Disability Advisory Service, and the Careers Service to support you throughout your learning journey. 98% of our students complete the course. And lastly, there's a global reach from the course. We have students from over 75 countries, and that allows you to connect with people all over the world. Next slide, please. Another thing I wanted to mention is about the two modalities that we teach through. And this is really about maximizing flexibility and also giving you opportunities to reinforce your understanding and engage with people. We have our asynchronous content, which you can complete in your own time. This includes videos, readings, e-activities, quizzes. Like I said, there's over 800 videos that we've specifically created for this course, and that's over 90 hours of content. Secondly, we have our synchronous content. These are opportunities to interact and engage with educators and other students. They include live sessions and teachers and guest speakers, but also opportunities to engage with the teaching teams between the hours of 9 and 5. Next slide, please. A really important thing I just want to mention that a lot of people ask us about is accreditation. So accreditation is a big thing in the US, but unfortunately, we don't really have the same process in the UK. Universities can't be considered either unaccredited or accredited. The UK government is the main body for controlling the degree awarding powers of higher education institutions and their right to be called a university. The higher education is assured by the Quality Assurance Agency for Higher Education in the UK, and this is a government appointed agency. We also have external examiners which make sure our course is valid, for example, and they're appointed for every higher education university. So UK masters are recognized in the US. If you do hear the term accreditation in the UK, it's just about that it's maybe accredited by organizations that are professional bodies like Chartered Management Institute or the British Psychological Society, for example. Next slide, please, Natasha, Anna. Okay, as I'm preempting myself, I'm going to hand over to Natasha now to walk you through a little bit more details of the course.
Great, thank you so much, Tom. So just to begin with, to make it very clear, there are multiple pathways that you can enter onto our course, so where you can submit your application to. And this slide just hopefully makes it clear. You can apply for the 2-year MPH, the 3-year MPH, and those both you would come out with a Master of Public Health degree. Or you can apply for a 1-year PG Cert in Public Health, and you come out with a postgraduate certificate in Public Health. Could we possibly go to the next slide, please, Anna? But just to highlight, if you apply to the 1-year PG Cert in Public Health, if you're successful at the end of that year, you will be asked, do you want to carry on? Because you're basically on the first year of the 3-year MPH. So you'll be asked, do you want to carry on to the PG Dip year, which is the 2nd year? And then if you're successful at the end of that, you'll be asked, do you want to carry on to the final year, which is the 3rd year, which is the full MPH? Just to please note, you won't leave with 3 qualifications. You will leave with whatever the highest qualification is that you receive. So if you go to the end of the 3-year, you won't get a certificate, a diploma, as well as an MPH. You will just attain an MPH, but you can leave at any point along those years. Thank you very much. Next slide, please. This is just an overview of our course. And as Tom mentioned, we have multiple different courses, which will show you lots of options for electives. And as you can see here, we have 10 core and you will choose 6 electives. And each module is approximately 7 to 8 hours. So it's really important for you to kind of check your own schedule, check your commitments when you decide which pathway you want to apply to, because in the 2-year pathway, this is more of a condensed. So you will undertake 3 modules per term, which means overall each week that will be 21 to 24 hours of study, and this will both be synchronous and asynchronous together, as Tom was saying. But if you have less time than that, then the 3-year pathway might be right for you, because then you're only taking 2 modules per term, and that's 14 to 16 hours per week rather than the 21 to 24. We have a huge variety of different types of assessments for our modules. All our modules, apart from the very final module, which is the Research Portfolio 4, has one summative assessment. But there's a huge variety, and you can see some of those listed there. Thank you very much, Anna. Please, could we move to the next slide? So the next few slides just gives you an overview of the course through the different pathways that I was discussing. So this is, if you apply to the postgraduate certificate in public health, this is what you will undertake. So as you can see, you'll be taking 2 modules per term, and in term 2 and term 3, you pick electives. The ones in green are core, so everyone has to take those. The ones in red, if you only plan to do the certificate, the ones in red you can take or you don't have to take. But if you want to complete the full MPH, you will at some point have to complete the ones in red, because they are compulsory. And the ones in pink are elective. Thank you very much, Anna. And this is the 2-year pathway. So you'll be taking 3 modules per term. And as I mentioned, at some point, you will have to complete the ones in red, the compulsory. You have to complete the ones in purple, that's the research portfolio. And then from the pink, you choose the ones that are most of interest to you or your future career aspirations. Thank you, Anna. And then this is the 3-year pathway. So as you can see, you take 2 modules per term, and it's exactly the same as what's available in the 2-year. It's just spread out over an extra year. Thank you very much, Anna. So I just want to touch upon a little bit about the research portfolio modules. This is a third of your course, and we don't expect any prior research experience. And it's over 4 different modules, because we take you by the hand and we take you through the main foundations of research, guiding you through developing your own research question based upon a topic you're interested and passionate in, teaching you about the different types of methodologies, so you create a protocol based upon that research question, teaching you about different core research skills, including ethics, funding, public involvement, and you, if applicable, you will apply and receive ethics. And then finally, in RP4 research, this is your research and practice, where you undertake, collect data, analyze, and write up that research project. I'm very happy if there are any questions about that to answer those at the end. I think that might be the end of my section. Can we just check? Yes, I believe I'm handing back to Tom now.
That's great. Thank you very much, Natasha. That was really clear. So it's now a great pleasure to introduce you to 2 of our alumni. Unfortunately, one of them isn't available today. So first, I'd like to introduce you to Paul. He's an associate professor of surgery at the Icahn School of Medicine at Mount Sinai in New York, USA. I hope that's correct, Paul.
That's correct.
Please, why don't you start by telling us a little bit about why you chose Imperial and why did you choose the MPH online?
Very good. Thank you, Tom. And it's very nice to meet all of you. You know, I've been interested in public health for a while, but it became more, my interest became more focused during and after COVID, when actually for a period of time, you know, our hospital suspended all surgical work, and we were entirely focused on, dealing with patients with COVID. But I came to realize, during that period that while as a surgeon, I enjoyed my work, but I realized that the impact we have is one patient at a time. I'd been working, I'm a bariatric surgeon, and most of the work I do, folks who have obesity and diabetes. And I realized that one of the things that we've not been able to do over the last decades is really have a major impact on the scale of the problem. And I realized that public health is a way of amplifying your impact. You can amplify things at scale. So I really thought this is something I would like to learn more formally. Now, why Imperial College? I have some longer standing relationship with Imperial College because my original residency was actually on the St. Mary's Hammersmith rotation. So I was actually on the Hammersmith for a long time, for a while. And of course, that was the Faculty of Medicine. So when it came to me exploring these options, Imperial was, of course, one of them. But the specific reasons why I chose this particular course has really got to do a lot with the actual curriculum and the faculty. I wanted to become, you read about all this infectious disease modeling and all the great projections and predictions that you do. And I wanted to become quantitatively more capable in a public health sense. So I looked at the curriculum and I realized that there are many things there, especially the elective, that I really wanted to do. For example, infectious disease modeling, I really wanted to learn how to do it. I also felt that Excel, really limited you in what you can do with data. So I wanted to get into, I wanted to become familiar with programmatic, statistics using R and things like that. So, and I realized that this course does allow you to do all that. I really liked the detailed inferential statistics modules and the regression modeling, but also there are a lot of other electives that I really enjoyed. For example, there's a very interesting module on healthcare innovations, which I really liked, enjoyed. And also health economics. I had really not paid much attention to health economics, but I really became fascinated by it. But the other thing I quickly realized was that while we take a lot of surgery for granted here, the major parts of the world have very little or no access to essential surgical care. And I sort of became very interested in global health. And in fact, my final project was on global health in low and middle income countries. Our Department of Surgery has an interesting, global health outreach in Uganda and a few other countries. So I'm hoping that will be in an important area that I'll be working in. But the other reason was really got to do with the faculty. I looked at the faculty and it was evident that they're all leaders in their fields. They're very well published. And, I attended the webinar just like folks attending today. And I have to say I was very impressed by the presentation. So I think that should give an overview as to why public health, why Imperial, and then why this particular course. The other thing I didn't mention is that, life as a physician and more so as a surgeon, especially full-time, is quite challenging. And I don't think I could have done an MPH without the flexibility that this particular online course allowed me to do. I could be on call and I could watch my video at 1 a.m. And I remember doing one of my videos skits. It was at 2 a.m. or 3 a.m. And, I had to do multiple versions of it, but I did it, but I think this flexibility was incredible. And I have to confess that, I sometimes just couldn't meet certain deadlines, but I realized that you could actually ask for, relatively short extensions. And, I would encourage those who are pressured for time to take advantage of that. So I think that flexibility was, I would say, an essential aspect of it, without which I don't think I could have done it.
Thank you, Paul. I mean, it's music to my ears to hear things like public health is the way of amplifying impact on scale. I mean, I don't think I could have said this any better. So thank you so much. I mean, that was really wonderful to hear about, the curriculum and the faculty and our flexibility as well. I really appreciate that. Do you mind if I ask you another question now before I ask Emmanuel? Can you tell me about, what have you learned? So you've learned all this in the MPH, but how are you applying it in your current role, in your current activities? And do you have any advice for those future students as well?
Yes, absolutely. Yes. I mean, one of the things that we do in bariatric surgery is that there's a lot of what I call registry data. These are relatively large volume data that, documents all bariatric surgical procedures in the United States. I've pre-MPH, I used to look at that volume of data. There are probably a few million rows of data there. And I would stare at it and I'd look at how I'm going to do this with Excel. But I've started doing some studies using that registry data, and I'm already quite comfortable with R and and doing various joins and with dplyr. So that is one of the things that I've started to do. The other intervention, I wouldn't call it intervention, that I met some folks from Tanzania at a global health event in Berlin, I think it was earlier this year, and we struck up a conversation regarding lack of general surgical, essential surgical services, and I'm actually going to collaborate with them in exploring indices of essential surgical care in a few villages just outside the capital, but also study the potential economic impact of improving those indices. So, but I'm also interested more specifically in the area of obesity and diabetes. I wanted to, when I say I wanted to, there are large data sets in the Institute of Health, disease burden portal, which I learned about during this course. And I've come to realize there's a massive trove of data on diabetes, obesity, and a lot of oncological conditions. And this is one data set that I want to explore because I think there's good reason to believe that both obesity and diabetes are very closely connected to several oncological cancers. Many gynecological cancers, breast cancer, but also increasingly evident various GI tract cancers. So those are areas that I'm getting into that I think will somehow scale up my work. Now, advice for incoming students. Well, I would say there are a couple of things that I really would encourage folks to do. One is try your best to attend all the live the courses, the live events, because I think you actually get to engage not just the faculty but also your peers, and we all ask questions, and I find that actually helps illuminate your own understanding. But the other aspect of the MPs that I really liked was the office hours. Outside the course, you realize that, I'm not quite sure if I understand this area very well. So, you sort of write down all your questions and you go to office hours. But I think at office hours, it's far more leisurely, and I found a lot of my, things that I didn't quite understand very well clarified during those sessions, and I found it very, very helpful. The last thing I would encourage folks to do is I think this is really a great opportunity to master some important quantitative, skills, and also understand some important programs such as R. I think it'll be unfortunate if you finish your MPH and you can't do certain quantitative things, but because I think to some extent public health specialist has, in my view at least, become comfortable with dealing with larger scope of data beyond that is typically handled by Excel spreadsheets. So I think and then I think I'd also encourage folks to think about how they could make use of the MPH. And I think it's not just doing your MPH and hanging your shingles on your wall, but I think you can actually really put it to good use.
Oh, that's really wonderful to hear. Thank you so much, Paul. I really appreciate you joining us today. And again, so many positive things around our flexibility and the office hours. I know a lot of students really appreciate these, live sessions, but also opportunity to engage and chat. And I agree. I mean, more data competency skills across the world, I think, for analyzing this routine data, which is just a trove of valuable resources that we really need to better use. So thank you so much. I'm going to move on to Emmanuel now. Emmanuel is a surveillance officer at WHO country office in Nigeria. So thank you, Emmanuel. Are you still here to join us? That's great. Thank you. So I'd really like to also ask you similar questions as well. Do you want to tell me about why you chose Imperial and why did you choose this course? Thank you.
Thank you so much for this opportunity. It's a privilege that I feel honored to take, and also thanks to our upcoming colleagues for attending this webinar. I think this is a great opportunity for you to hear from the lecturers here, professors, and also to hear from us. We just graduated a few weeks ago. I think, and I will say confidently, that choosing Imperial is one of the most important decisions I've taken. And being a surveillance officer at the WHO country office is very demanding, and working in emergencies, it's something that sometimes you can predict, but usually comes at a time that and the capacity that you don't expect, the size, the magnitude. And this program, particularly the curriculum, has a design that covers areas that I have weaknesses. I have postgraduate in tropical medicine as a doctor. I still know that I have deficiencies in data management, data analysis, and I have to look for where I can learn to bridge in these gaps. And through my search, several schools, top schools in the world, came across Imperial College London. I've gone through the curriculum. It's robust, it's intense, and I will say that the curriculum is intentional. If you look at the curriculum, I'm not trying to scare you. It's going to make you to be very active. And but the good thing is that the lecturers are very supportive. And you should not be afraid of the quantitative nature of the course. The foundations you have in biostatistics here, epidemiology will go a long way in supporting your work if you work in a place like me, in the WHO surveillance department. Number two, the flexibility of this course also encouraged me to apply. And even though the flexibility will not allow you to really do what you want, but at least you will be able to adapt and be able to submit your assignments within the time frame. Now, my colleague is a surgeon. I know surgeons are also faced with emergencies, but if you look at infectious diseases in a place like Nigeria, if you say you're going to submit your assignment in 2 weeks, within a week, you can have 3, 4 multiple outbreaks. So you have to look at where you're working and how you're going to arrange your work and also be able to meet up with Imperial College London. If you think you're going to start your assignments in the next 1 week, you'll be shocked if you're working in a place like me. By the time you start your assignments, 3 outbreaks will come. So I will suggest here that whenever you have an assignment, even though they've given you a timeline of 1 month, start it immediately and keep working on it every day or every week, and then you'll be able to submit. I'm sorry, in my discussions, I have to, come across different crisscross the questions as they come to my mind. Then number 3, of course, and to me, it's very, very key, the reputation of Imperial College London. We have to be sincere. It's global ranked university. And especially if you look at the scientific part, medicine, it has consistently maintained that position as a leader globally. And for me, working in WHO, having a degree from this school, it's a plus. And I hope a lot of you will also look at that as one of the supporting reasons for applying to this Master of Public Health online program. While for the advice that I will have for you, the first day you get your admission, get engaged with your fellow colleagues. The faculty people are your great assets, but your cohort will go a long way in supporting you through your assignments, discussions, etc. And of course, looking at the future, if you're working in an organization like WHO, MSF, etc., you need to collaborate with different partners. You need to collaborate with colleagues, and you learn it from the MPH program. And you learn from colleagues. There are different experiences. Some are coming from Global South, some from the North, and then these people have different experiences. People coming from the UK, US, they will be talking to you about obesity, while here we'll be talking about diphtheria, we'll be talking about measles, etc. So you'll be very surprised for people coming from Sudan talking about mycetoma, a disease that I have so much interest and where my research focused on during my period of study in Imperial College London. And number two, also, I will encourage you to put in your best to start thinking about your research topic day one. So the more you start thinking early about your research, the easier it becomes for you to beat the timelines and finish without panicking or having palpitations. Because the research in Imperial College London, I will tell you, honestly, it's very intense, it's comprehensive, and especially if you choose a topic that requires you to really go deep, then you have to start as early as possible. But the good thing is that you have support, the lecturers, and also especially the library. That is one of the things that impressed me in Imperial College London. The librarians, they are wonderful. They are great. And I don't know what else to say. I'm just thankful and grateful. So this is brief that I can say because of time, sir, and we'll welcome questions from the applicants.
Thank you so much, Emmanuel. I'd like to just assure everybody that we did not pay both Paul and Emmanuel to be here and to say these things, because so thank you so much for saying all this. It's really wonderful. I was really impressed to hear about, you know, how it completely like clicks with your current role in WHO. I'm impressed. We designed the course around flexibility, including life events like work, family. But I'm so impressed that you can say that it's also flexible around emerging disease outbreaks in sub-Saharan Africa. I mean, we never even thought that that was going to be important flexibility here. Thank you for thinking about our reputation and how we work really hard to have this global impact. And I think I really liked how you talked about how these, these collaboration skills that you developed and working with diverse people across the world as part of the course has really been a benefit for you. So I'd like to just say thank you to Paul and Emmanuel for joining us. You're very welcome to shoot off if you would like to, because we have to move on to the rest of the webinar now. But you're welcome to stay and continue listening to the prospective students. So thank you again. I'm just going to hand over now to Natasha. Anna, if you wouldn't mind bringing up the slides again, and we'll just move on to the applications and admissions process. Thank you.
That will be me. So I'll just run you through how the admissions process looks like. Obviously, the first step is making an application. We always get in those webinars a lot of questions about very specific admission requirements, so we are able to answer some of them, but the initial screening of the application is done by the central Imperial admissions team. So and then it comes to us. So they have their own methods of checking whether students meet all the criteria, like academic requirements or English requirements, and then that application comes to us. So unless there is something general, we can answer it. But if you have any specific questions about your particular situation, just we will share an email to contact us via, so you can send us an email and check just whether you meet the criteria. So after making applications, so the first step is the central admissions team checks the applications for completion and general completion for the general entry requirements. And we will share the entry requirements in a minute. And then once it's checked and approved, then it comes to the reviewers in the school. And obviously there is experienced reviewers who know what the profile of the applicant student is and what makes a successful student. And if they have any further question, they need to want to know you better, they invite you for an interview. Now, once you're successful, then you will receive an offer. And also we will mention that in detail in a minute. And if you're happy with the offer, you want to go ahead, obviously you accept the offer. In the offer, there will be some conditions to meet, sometimes English conditions, sometimes we do need academic transcript because for some reason it's been delayed. Sometimes we were, and this is the, I think the most frequent reason for delays in applications, the references. Sometimes we wait for the reference for a long time. So once you submit, make sure that your referees know that you are applying. So once they got an email from us asking for references, just please make sure them to be quite prompt in replying to us. And once all the offer conditions are met, then you'll be made a full offer and you can go ahead and enroll. So what do we require from you for the first stage? Obviously the degree transcript. So the current requirement for the program are 2.1 UK qualifications, but we will share the slides after the webinar. When you click here, you'll see the entry requirements for every possible country. So obviously they will differ. And doesn't have to be medicine, doesn't have to be any health sciences. So if you want to change career, you're welcome. We have students from all sorts of backgrounds and they're successful, they enjoy the program and they go ahead to be even more successful after completion. What else we need? We want you to send us your CV, your curriculum vitae. We're interested, since we kind of on a fully online program, so we tend to attract mostly full-time working professional people. We will be very interested in your professional experience, especially if you have graduated like 10, 20 years ago, and you want to show off that you have done a lot since that time. So we will be looking at that. And as I mentioned, we will need 2 referees. So the references need to come from the organizational email addresses, not the personal ones. They will not be accepted. And last but not least, and that Natasha will discuss it in detail, personal statement, why you want to study with us. So with regards to application fee, you may have to pay an application fee if you're applying for the masters. The fee is £90. However, we can make it disappear. So there are some, we have some codes, limited number of fee waiver codes that we can share with you if you approach us. There's also application to waive that fee, and there's also a link how to do it. If you apply for postgraduate certificate, there is no fee. So yeah, and just a tiny note that a lot of our postgraduate certificate students like it so much that they stay and complete the full program. Okay, and I'll pass you over to Natasha to talk more about what the reviewers are looking for in your personal statements.
Great, thank you so much, Anna. So I'm one of the reviewers, the admissions reviewers for this course. And as Anna said, your personal statement is an important part of your application. We recommend that you complete about 1 A4 page to 2 A4 pages for this. And you really should just, it's a narrative explaining to your reviewer why you're applying to this course. So, you know, as Anna said, we accept people from wide range of background. You don't have to be in public health currently. But if you're not in public health, it's really important for you to explain in your personal statement why you're applying to this course then? What interests you? And I can highly recommend, it's really helpful if you have a look at the curriculum and you're able to kind of illustrate what is it about our curriculum that interests you. Are there particular modules? You know, what is it about this MPH that interests you, which is why you're applying to public health, and MPH more generally, but then also this particular MPH. And also you should outline your relevant experience. I understand you may not have any work experience in public health, but often if you're interested in applying to a public health course, you might have done MOOCs online, you might have done volunteering, anything, any experience that you have that's relevant to public health, you can outline that. I know you might have mentioned it on your CV, but this is a space for you to kind of expand upon that detail. Any research experience that you might have had, you can expand upon that. So it's really just a chance for you to use your own words to explain to the reviewer why you're applying to this course. Thank you, Anna.
Natasha, just a quick question for details. There's a question of very detailed, how many pages exactly, how many words, single or double spacing, what size font? So any guidance on that?
Yes, I believe there is guidance on the Imperial webpage. I'm not sure if it's in the slides, but 1 to 2 A4 pages is sufficient. If you have anything, if you're only writing a couple of paragraphs, that's generally too short. You do need to have some detail. So anything around the 1 page to 2 page mark. In terms of font sizes, no specific preference, but it has to be readable. So yeah, no specific, and it doesn't need to be double spaced or single spaced. Again, no preference, but it just needs to be readable. As long as you cover everything that's outlined on this slide, and you've covered it sufficiently, you don't need to go into too much detail, but you at least hit the highlights. That should be sufficient. Great, thank you. So the top part of this is just highlighting briefly what Anna mentioned before. This is what we're going to be assessing on your entire application. We'll be looking at your transcripts. We'll be looking at your CV, your references, your personal statement. And you may be invited to an online interview. This might be because you didn't meet the minimum degree requirements and we would just want to talk a little bit more about your experience. Or it might be that we just want to give you a chance to expand upon what you wrote in the application. And the interview is just a short, informal chat. So as I say, just give you a chance to expand upon your application, because sometimes even though you've written a personal statement, it's just nice to have a face-to-face online discussion with someone, just to be able to ask a few more questions about your experience or your motivation, your interests, your career aspirations, your previous experience. Thank you. And I believe I'm handing over to Patson now.
Thank you, Natasha. All right, so the next stage in the admissions process is after you've received an offer, if your application is successful and the School of Public Health reviewers have decided to make an offer. So the next stage is receiving and accepting your offer. So on the admission system where you make an application, your offer will appear as condition pending. And that means you have 21 days to then accept your offer. So once you accept your offer, the status will then change to condition firm, and you must meet all the offer conditions that are laid out to you by the central admissions team. So the offer conditions could be an English language test if it is required or not. They'll let you know. You'll have to submit your academic qualifications, which is usually your academic transcripts basically, and you're getting your degree verified. And the final condition will be a payment of a 10% tuition fee deposit. And also, if you are enrolled on another program, you'll have to withdraw from that program because we do not allow for dual enrollment. So once all your offer conditions are met, the status will then change to unconditional firm and you'll be ready to enroll on the program next year. Next slide, Anna, thank you. So if you do require an English language test as part of your offer conditions, then you must meet and achieve the higher university requirement for English. So there's a few examples here. For example, IE LTS, a 7 overall and a minimum of 6.5 in all elements. And if you do take a TOEFL, then you need 100 overall with a minimum of 22 in all elements. And we also have the Duolingo online test, where you have to have a 125 overall with no less than 115 in any subscope, basically. There are also other tests that are accepted. So there's a link on the slide which you can visit. Will take you to the college website, and you can see the other available tests. And dual enrollment, just another note, you cannot, again, like I mentioned earlier, you cannot register the more than one award at the same time. This includes awards at Imperial as well, or any other universities. So you must deregister from your current course before starting on our course. Thank you. Next slide. Yeah, so we also offer funding support. There's scholarships available. You can search through the Imperial Scholarship search tool on the college website, see what's available. But the School of Public Health also offers a master scholarship, which is a one full fee scholarship for, and it covers both the home and overseas fees. So applicants who are submitting for the scholarship should also submit a separate application, and you'll find more details on the college website. The scholarships change throughout the year, so we suggest applying early so you can check back for your results later during the year. Thank you. And the next slide, please.
And we back to Tom, I think.
Thank you. Yes.
And the Q&A.
And the Q&A. So I'm just going to Q&A. Yes, I'm just about to launch it. I just wanted to make a note on the scholarships. So the team working really hard to negotiate with different funders to secure other scholarships in the future. We can't always guarantee that these become available at the beginning of the year. So do keep going back and checking. We are really committed to identifying other scholarship opportunities to widen the reach of this course. So keep checking and keep looking. So a couple of quick questions that often get really commonly asked on the course. Do I need to attend any person in teaching? No, you do not need to ever come to London. You do not need to attend any of this. However, we do invite all students to attend their graduation ceremony in person at the Royal Albert Hall in South Kensington. I'm looking forward to seeing Emmanuel and Paul, hopefully in May next year. And it's a really wonderful event. Many people ask if they can still apply if they don't have a clinical or scientific background. As Natasha said, we accept students from loads and loads of diverse different backgrounds. It's just about demonstrating your commitment to public health. It doesn't even have to be through your job. Another thing is our degree certificates don't say online. It says you have a degree in the Master of Public Health, and there's no mention of the online, which I know many people feel very important about. So I think I'm going to just open up the Q&A. We've got, Anna and Scott have done a fantastic job of answering many of the questions. But Anna, perhaps if you could take some of the open questions to start with that you'd like to.
Absolutely. So here is just the contact email address, so you just note it, but we will be sharing the slides, and there's a link to our program page. So the first question is, what type of careers have our students pursued after the program? So I think, Tom, do you want to answer?
Yeah, I'm happy to answer this. I think this is a really difficult question because we have a huge community of different people joining the course. Some people come quite advanced in their careers. Some of our oldest students are actually way past what many countries have retirement ages are. Many people are young, just fresh out of university. Some people are using this as an opportunity to launch their careers. People are going into public health roles. People are going into sort of NGO roles, academia, consultancy, professional services. But others are using this as an opportunity to career change later on in life. Some people are already working in organizations, big NGOs, maybe the surgeons, for example, like Paul or Emmanuel at the WHO country office, and they're looking to strengthen their skills, maybe looking for promotion, looking to sort of redefine what they're currently doing in their roles. So unfortunately, we can't answer that question. We don't have like really robust, detailed data on where everyone goes, but it's really, really broad. We get loads of positive experience back. And if you go on YouTube, you can see some of our previous webinars. And again, we didn't pay for these alumni, but loads of these people talk about how we, these have led on to promotions and new careers and new opportunities. So we're really we know this is a really supportive course for those careers in public health, and we know that students really benefit from that, whatever your pathway is. Great. Scott, did you want to start with the next question?
I do indeed. So there is a question here about the ratio between synchronous and asynchronous components of the program. Tasha, I think that's one fielded to you, I think.
Yeah, absolutely. Thank you. So in terms of what you can expect, I would say it's slightly different for each course in terms of the synchronous. But just to clarify, all the live sessions are recorded. We do understand that students can't attend. We do alternate between morning, afternoon, or middle of the day in the UK. So we're trying to ensure that at least some of the live sessions that you can attend, but if you can't attend, they will be recorded. You can watch them back in your own time. So most modules, they will have a live session every week or every other week, and that will be about an hour to 2 hours. And then normally every week, there's also an office hours. And then the rest of the time, your learning time will be going through the online content on our virtual learning environment, which was everything that Tom was mentioning earlier, the videos, there'll be some reading, some activities, and then obviously you'll be spending some time working on formative assessments or summative assessments. So it's heavier on the asynchronous, but there are definite synchronous sessions there to give you a chance to consolidate the information, ask questions to the teaching staff. And if you can't attend, you can still ask questions. There'll be discussion forums online, there'll be email, so you can definitely still ask questions. Thank you. I hope that answers your question.
Natasha, another question about the admission. So if somebody is just about to graduate and have very well just internship experience, how does it affect their application chances?
Yeah, no, thank you. I mean, the majority of our students, as I think you were saying, Anna, do generally tend to have been out of education for a while, but we do have students who have just finished their undergrad. So I appreciate we definitely do look at where someone is in their career path and whether or not they are in public health currently or they're changing career path. So if you have internship experience, then please do, talk about that. If you have some volunteering experience, even if it's not extensive, you can talk about that. But you also can talk about your passion if you've done some extra online learning. So this might be a free MOOC, or you've been reading some journal articles. There's lots of ways to illustrate your interest, your passion, your motivation for public health beyond working in public health for 5 years or more. There are definitely ways to illustrate that. So please don't think you can't apply if you're just ready to graduate or you're not currently working in public health.
Last but not least for you, and there's one for Patson. So what's the difference between then our online and in-person programs?
I don't know,
if the
Tom,
students already applied, if the student already applied, do they need to apply again?
There's a few questions. So obviously the online program and the in-person program, they're built from scratch very differently. They cover the same core competencies of public health. We have essential core competencies that you must cover, but there's a lot more flexibility on the online course. And it's been completely designed so that you can do these things part-time, that you can choose more modules. So there is a lot of difference, but what you get out at the end is the same degree, and you cover the same core principles, although taught in slightly different methods and different modes. I think if you're applying again, I'm not sure on the practicalities of this question from Bernard. I don't know if you can transfer the application or not, but again, if you are reapplying to the MPH online, think about why the online one is maybe what you want to do rather than the in-person one. And also, it's good to hear that you're thinking out things like the Chevening and Commonwealth Scholarship. Is there anybody, Scott, if you want to add anything to that? I think I've missed a few bits.
I think, Patson, you're probably better placed to answer a question on scholarships. No worries.
What is the question on scholarships?
So So the first question is whether somebody can transfer the application from on campus to online if need be, or need to reapply.
So they do have an option to choose a second choice application, and that way I think it'll be an easier transfer from if they choose the online as a second choice or the on campus as a second choice, it'll be easier to transfer. But then we can also transfer the offer internally if they make a request. The applicant will need to email MPH Online, and then we can check within our departments and see if it's okay to transfer the application. But it should be fine. But we might not be able to transfer an application once they've already paid the tuition fees and they're ready to enroll. So the request has to be made really early on.
So that Bernard will need to contact us directly about that. There's another question, but I think direct contact would be also needed. So if the application is on hold, I think they need to contact us to see.
Yeah,
what
so I saw that question. Yeah, so yeah, if an application is marked as on hold, that means the central admissions team is still checking a few details with the application, and they'll be in touch with you soon. But in case there's no progress on it, then you can email us your CID and your full name through MPH Online and Imperial, and then we can have a look with the admissions team for you and get it fast-tracked, basically.
That's great. Thank you, Pat. And I think we've answered all the questions in the Q&A. I really appreciate everybody joining, and thank you for the team for being super responsive to lots of complex questions. I know we've run out of time. I just really want to say thank you to everyone who's joined us and listened to us today. Thank you for taking your time out to hear about the program and our application process. Any queries, there is the email address. Go on the website. Please get in touch. We're very happy to respond. Thank you to our wonderful alumni. Manuel's still here, but also thank you to Paul, who's left. And last of all, thank you to the rest of the MPH team who are here today. So all the best, everyone, and have a good rest of your day. Thank you.
Thank you, everyone.
Thanks, everyone.
Thank you. Bye.